Dr. Avery Young at the Center for Hip and Knee Replacement in Santa Monica. And let's spend some moments looking over the actual appearance of arthritic hip bone so that you will have a structural understanding of what is happening inside a painful arthritic hip. So before we look at the actual specimens, let's step back and see what a schematic or an idealized drawing looks like. So going back to basic anatomy, the hip joint is a combination of the acetabulum, or the pelvic side, and the femoral head, or the ball side. So the hip is a ball and socket joint. There's an acetabulum, and then there's a ball of the femoral head. But very importantly, between the bones, there's cartilage. Cartilage is made of collagen, and it represents a layer that allows the bone to transfer load to create power. It's also a frictionless surface that creates motion and flexibility. Now, over time or with injury or with wear and tear, this cartilage or this collagen can break down, and then a patient can go to develop an arthritic hip, which is bone on bone. And then you see roughening and bone spurs and an irregular weight-bearing surface. So this is what it looks like conceptually. We go from arthritic, we go from cartilage protecting the surface of the femoral head and the acetabulum to an arthritic hip with bone on bone and loss of cartilage. And I'll show you what that looks like in different stages. Let me show you an example of what an arthritic femoral head actually looks like. So this is the femoral head here. You can see it's spherical, but it's not a perfect circle. And then this is the equator here. And on the undersurface, this is cartilage. And then this is the area of arthritic bone or absent femoral cartilage. And we can see the underlying bone. I'll show you what that looks like. Over here, this is the undersurface, and you can see that's cartilage. Cartilage is the collagen, and in an organized form, it's thick and it's molded to the edge of the surface of the bone. But as we go up to the equator, we can see how that cartilage is beginning to thin, and then eventually it goes to bone on bone. Okay, so that's one example. Here's another example here. We can see femoral head, again, spherical, but not a complete circle. Here is the equator. Here below we have cartilage. Here we can see cartilage breaking down. In the last slide we saw bone here, but here we can see these little punctate lesions. This is the underlying cancellous bone. We're now starting to wear through the surface of the bone in this specimen. Equator, bone on bone, cartilage at the undersurface, bone on bone. This is a more advanced arthritis. We can see the femoral head. We can see the equator here. A little bit of cartilage. This stripe here is an area of worn cartilage in transition. This is bone, cortical bone. But below the cortical bone, there's cancellous bone. And we can see we've worn through the cortical bone, and we can see the underlying cancellous bone coming through. Cancellous bone right there. This is the equator of that stripe. These are all bone spurs all around it. Okay, and that's an example of a more advanced stage of arthritis. The importance of this is just understanding what is happening structurally inside the hip. Many people know hip arthritis is just something that's painful, but it's often helpful to know what is the source of the pain. And it goes back to understanding the anatomy. In a healthy hip, there is cartilage protecting the surface of the bone to allow transfer of load. In an arthritic hip, that cartilage has undergone a process of wear and tear, is now absent. Now there's exposed bone, and those bones grind to create friction and discomfort.